I'm Dr. Glen Gordon. I spent the last 25 years in a sports medicine practice, and I'd like to talk to those of you in our audience who are interested in sports injury. The old traditional manner of treating a sports injury was to slap ice on it immediately. But a large study out of a center in Australia demonstrated that ice, without the application of pulsed electromagnetic field technology in conjunction with it, was ineffective. I think of ice as trying to use Ty Cobb's glove to field ground balls. You know, that's old history. And I think that the application of ice in these injuries might stop pain, more or less, but I don't think it heals anything. And there's substantial evidence that it increases the amount of free radicals, which would make the injury even larger. Let's talk about something else that's very commonly used, that the American Heart Association even came out recently to say you should be very careful about their use, and I'm talking about anti-inflammatory drugs. If you're a teenager, for example, or a young adult, and you're taking these drugs, you may get damage to your arteries now that could lead to heart attack or stroke later. The American Heart Association pointed out that among the drugs that could potentially cause these heart attacks and strokes were Aleve and Advil. Interestingly, in the ads that you see on television, they don't talk about heart attacks and strokes, they don't talk about kidney and liver injury, and yet there's almost no physicians like myself who have not seen someone suffer kidney or liver damage. For example, Ken Easley, one of the greatest athletes I've ever met, had his kidneys seriously damaged with the use of Aleve. What should you do? Well, let me show you a cell phone-sized pulsed electromagnetic field technology. It's called EMpulse. Use it immediately, and by the next morning, you might expect your injury to be gone. Believe it or not, we have taken acute ankle sprains. We have treated them immediately at the side of a football field or the side of a soccer field. And the kids that we treated came in with no injury the following morning, and the kids that we hadn't treated came in using crutches or with the help of their parents. EMpulse is guaranteed. Do you know any guaranteed drugs? So here's the best treatment. These injuries that you have in sports involve a motion segment. Keep that motion segment moving as much as pain will allow you, because if you don't use it, you lose it. One of the things we've discovered, and don't you wish you could do this, if you use EMpulse before, during, and after injury, during being immediately after you get it, before you protect the cells from damage associated with the swelling and loss of blood supply. That's because of a special protective protein called heat shock protein 70. I'll bet you're glad I told you that one, aren't you? During the injury, you minimize these dangerous free radicals that I pointed out earlier. Ice may actually cause more of, and after the injury, you actually stimulate these healing genes. We saw many athletes who were able to return weeks faster than those who had simply had ice and drugs. And that was whether they did or didn't have surgery. Thank you very much.